Well, it was my birthday, June 15th and Father's Day. We'd had a lovely day. Had gone to church, had walked our dog, done all the things we really like to do, talked to our children. And it was about 10 o'clock at night, and we were in bed reading, which we normally do. And I got up to turn out the lights in the bathroom. And when I got there, I couldn't breathe.
There's never anything more frightening than having one of your family members yell out for you and tell you to call 911. I ran down the hall, and he said, "I can't breathe, call 911. And it was, he truly could not get a breath. And it wasn't any, wait a minute or anything else. He said, "I've got to go to the emergency room."
And I remember the ride to the hospital was pretty fast, but it felt like it was forever because I still couldn't breathe. We got to the hospital, and they rolled me out of the ambulance into the room.
When Mr. Ken Hill arrived to the emergency department, he was in a significant amount of respiratory distress. As soon as he got there, the nursing staff and I immediately got him hooked up on cardiac monitors. We began to give him some medication in the IV to lower his blood pressure because we felt as though that was the reason why he was having the respiratory distress.
Now, I've been scared in my life. The scaredest ever was in Vietnam in 1964 in a rice paddy where I'd gone in to pick up a wounded American, and the aircraft was being shattered with rounds from an automatic weapon. And I was really scared. That's the scaredest I was in 2 years in Vietnam. Well, June 15th, the night of June 15th, I was that scared. I thought I was going to die. I was convinced I wasn't going to make it.
I remember when the doors opened, I could see Ken was in the room all the way down the hall. And there were 5 people working on my husband. It'd been a minute.
They'd tried everything to get me to breathe, and it just wasn't working. And Dr. Walker walked in, God bless her. She looked me in the eye and she said, "Mr. Hill, I have to put something down your throat to take over the breathing for you. If I don't, your heart's going to explode." And I said, "Please do it," because by that time, I was really desperate. And that's the last I remember.
The atmosphere in the ER is a sense of teamwork and camaraderie. Everyone is working together to take care of patients. Everyone has the same goal in mind, the best possible treatment for the patient.
I mean, it was just always, we knew we were in great hands. Our doctors were there, the nurses were great, the organization supported us. We just never felt any need to even question anything.
It's the scariest I ever was in my life. And I've had a lot of scares in my life. I've had a great life. I've had an interesting life. And I continue it because of this hospital.